So here's another daily do from your local dermatologist. So what is a cyst? A cyst is a collection of fluid that forms underneath the skin. And they can be caused by different things. So sometimes some genetic conditions, sometimes acne, you get big cysts with acne. Sometimes some trauma, whether that is like if you get poked or something, then that induces the fluid underneath your skin around the hair follicle to form and get bigger and bigger. And sometimes you're just prone to them. Now please have a conversation with your local dermatologist, because step number 1 is making sure you have the right diagnosis. And then step number 2 is figure out the risks, the benefits, and the options of what you do with it. I do not recommend you trying to squeeze and pop them, because that's, in my opinion, where you get all the problems that Dr. Pimple Popper treats later on. We don't want to create problems, and those problems can be scarring, they can be infection, they can be spread of the cyst, they can be all sorts of things. I personally like to cut most cysts out, and the reason is because we don't really know they're a cyst until we cut it out and look at it under the microscope. And every year I get a couple of cysts, and they actually turn out to be cancers under the microscope. And any new bump, any new growth, anything that's growing or changing in your body really needs to be seen by your local dermatologist to make sure that we have the right diagnosis. You've got to have the right diagnosis. Everything past the right diagnosis isn't worth much if you don't have the right diagnosis. So I like cutting them out. We do have excision videos so that you can see what that is like. And so does Dr. Pimple Popper. But please, you get a new bump, you get a new growth, have it looked at first, and then determine what treatment's right for you.